Magandang araw sa inyong lahat and welcome to week 2 of our subject NCM 107 or Concepts in Pediatrics. Ako nga pala si Teacher Jeffrey Raboron. I'm a registered midwife, a registered nurse, and I'm also a clinical nurse educator. And welcome to my educational video. Today, we will be continuing with our lesson about maternal and child health nursing framework, and this time we will be understanding the different theories that are related to nursing, along with the roles and responsibilities of the maternal and child nurse, and our roles, of course, as nurses in the implementation and the achievement of the Sustainable Development Goals. So please bring out your handouts so you can follow along our discussion. Let's begin! I'm not sure if you have already heard this, but most people say that nursing is an art, and therefore, as artists, we have so many different versions of what art is. So parang tayo din as nurses, we have so many interpretations of what nursing is and should be. Now, kailangan nating pag-aralan ng mga theories related to maternal and child nursing so that we can also understand how care should be delivered or dispensed to our patients. Lagi niyong tatandaan that care is individualized and depende po yung quality of care mo sa inyong understanding of the philosophy of what nursing is. So pag-aralan natin kung ano ba yung mga tingin ng ating mga nurse theories to what nursing is. Now, let's talk about the theory of Patricia Benner. According to Patricia Benner's nursing theory, it is about nurses gaining experience over time. So dito, nursing is a caring relationship according to Patricia Benner, and nurses grow from novice to expert nurses as they practice in the clinical setting. According to Patricia Benner, nurses move through stages from the beginner to expert by learning from real experiences. And it's like going through from knowing little to becoming highly skilled through practice and learning from situations. So according kay Patricia Benner, gumagaling daw yung isang nurse, therefore gumaganda din yung quality ng care na kanyang binibigay if the nurse is practicing nursing. So lahat daw tayo, we practice nursing. We should practice nursing so that we can move from being novice or beginner carers until we become expert carers or expert nurses. Yun po yung theory ni Patricia Benner, that we move from novice to experts if we practice nursing. Because, like I said, nursing is a skill. Patricia Benner believes that the more that we give care to our patients and the more that we practice nursing, we become experts in the field that we do. Gaya nga ninyo, after you graduate, you start first as novice nurses. But the more that you become volunteer and you get hired as staff nurses in a specific hospital, and the more that you practice these nursing skills that you have, and the more opportunities that are given to you when it comes to caring and exercising your skill as nurses, the more that you become better at your job. So that is the idea of Patricia Benner, that nursing is a skill and therefore it can be practiced. So huwag kayong mag-alala kung nagsa-start kayo bilang nurses and meron kayong mga konting pagkakamali or nahihirapan kayo sa pag-dispense ng isang duty because you're just a beginner, and that is okay because we learn as we go along according to Patricia Benner, and the more seasoned we are, the more experts we are at our job, the better the quality of nursing service that we provide. So yun naman yung paniniwala ni Patricia Benner, that we can move from novice to expert nurses in the clinical setting because we can practice it. We can practice our skill as nurses. Now let's also have a look at what Dorothy Johnson has to say when it comes to her idea or understanding of what nursing is. According to Dorothy Johnson, a person comprises subsystems that must remain in balance for optimal functioning. According to her, any actual or potential threat to this system balance is a nursing concern. So, ibig sabihin niyan, Dorothy Johnson's nursing theory is about helping patients find balance in their lives. And it is our roles as nurses to assist patients in managing stress and maintaining stability. So gaya ng sabi ni Dorothy Johnson, tayo daw ay tumutulong na ma-attain ng ating pasyente yung kanilang sense of balance and equilibrium by helping them or giving them assistance. So nurses assist patients in managing stress and maintaining stability, and it is like supporting people to stay steady in their physical and emotional well-being. Yan po ang understanding ni Dorothy Johnson sa nursing, giving or assisting our patients so that they can live a life of balance. Now, in the case of Dorothy Johnson, she believes that we nurses can provide care to our patients, and the quality of care that we give them can help them achieve a balance. For example, we see a mother who just gave birth to her child, and because of that, dahil nga kapapanganak pa lang, siya ay medyo mentally unstable. Siya ay nalulungkot bigla-bigla because it's her first pregnancy, and she gets worried na she might not become a good mother. Now, as nurses, that is where we step in. Kasi nga po, we have to be able to determine what causes the imbalance in our patients. And we also have to be sentient or sensitive to these changes that may tip the balance. So, ibig sabihin, since nakita daw natin na merong imbalance yung ating mga pasyente, we have to give them support or we have to give them education so that they can return to their balanced self once again. So, dun po tayo pumapasok as nurses. We do not just look at the physical imbalances of our patients, but also to their emotional imbalances. So, yan po yung sinasabi ni Dorothy Johnson of what nursing is. Iba naman po yung understanding ni Imogen King of what nursing should be. According to Imogen King, nursing is a process of action, reaction, and interaction and transaction. Needs are identified based on the client's social systems, perceptions, and health, and it is our role as nurses to help the client achieve goal attainment. So sabi ni Imogen King, her nursing theory focuses on understanding the patients and helping them reach their goals. So sabi ni Imogen King, we have to first interact with the patient and get to know them, transact with them, so that we will know what they want and we can help them reach their health goals. Nurses work together with patients through collaboration, and it's like creating a plan to support the patients on their journey to better health and well-being. Yan din naman po yung theory ni Imogen King of what nursing should be. In the case of Imogen King's theory, we can better exercise it or observe it when we collaborate with our patients in creating different plans of care that are fit or individualized for their needs. So sabi ni Imogen King, kailangan daw nating makipag-transact sa ating mga pasyente, maki-interact sa kanila, and we have to know what is really their outcome that they want. So dapat yung outcome sa identification, sa planning, kasama po ang ating mga pasyente so that we can help them attain the goal that they set for themselves. So gaya nga ng sinabi natin lagi, kailangan po natin na makikollaborate tayo or makipartner tayo sa ating mga pasyente and let them verbalize what really is that they want when it comes to their health and well-being so that we can plan accordingly based on the patient's set goals and objectives. So yan naman po yung sinasabi ni Imogen King, that we have to transact with our patients, help themselves identify the different goals that they have when it comes to their health. Now, let's also understand Madeline Ler's concept of nursing. So, si Madeline Ler po ang nagpauso ng transcultural nursing theory. And according to her, the essence of nursing is care, and we need to provide transcultural care to our patients, and the nurses should focus on the study and analysis of different cultures with respect to the caring behavior. So Madeline Ler's nursing theory is about understanding and respecting different cultures in healthcare, and it is our responsibility as nurses to learn about our patients' beliefs and practices so that we can better provide them the care that they also want that is culturally congruent. It is like making sure that the care fits what the patient's values and believes in. So, ibig sabihin yan, dapat po we have to consider the different transcultural backgrounds, the tradition, the beliefs of our patients in planning our care. So, hindi lang po yan because we want to help achieve the goals that they set for themselves, but it is also part of our responsibility in respecting the patient's identity and dignity. So, according kay Madeline Ler, kailangan po nating pag-aralan yung ating mga pasyente, know what they want, what they believe in, their perspectives, so that we can give them a culturally congruent care. Example, you have a patient who just gave birth, kapapanganak pa lang yung babae po, and then she lost a lot of blood. As nurses, you do not immediately say, oh, the patient has lost a lot of blood. Doctor, should we do a blood transfusion? Hindi po ganon. Because we still have to consider many cultural stuff. Like, for example, is the patient a Jehovah's Witness? Because if a patient is a member of the Jehovah's Witness, she will not want to be transfused with blood because their religion permits them from receiving blood transfusion. So as nurses, planuhin mo, hindi dahil sa pasyente yun na kailangan niya ng dugo ay sasaksakan nyo na po agad ng dugo, hindi po pwede. There are certain things that you need to consider for your care to be culturally congruent. So you also have to make sure that the care that you give to your patients are appropriate to their culture, their beliefs, and their traditions. Yan naman po yung thinking ni Madeline Ler when it comes to her concept of what nursing is. Now, let us also discuss the environment theory by Florence Nightingale. Ito po yung isa sa mga pinakasikat na nursing theory that we have, and that is of course by our very own Florence Nightingale. Now, according to Florence Nightingale, the role of the nurse is viewed as changing or structuring the elements of the environment such as ventilation, temperature, odors, noise, and light to put the client into the best opportunity for recovery. Naniniwala kasi si Florence Nightingale that our environment plays a vital role in our health. Naniniwala siya that if we keep an ill person in a healthy environment, the environment will be conducive towards improving that health of this individual who is sick, and therefore makakatulong daw po yung environment to help heal this sick individual. The same is true when the environment is unhealthy. Kung yun daw pong environment is unhealthy and you place a healthy individual there, what will happen? The environment will also affect the health of the patient, turning this healthy individual into an unhealthy individual. Yun po yung thinking ni Florence Nightingale, that our environment plays a vital role in our health and well-being. Florence Nightingale's nursing theory is about keeping our patients in the best environment for healing. And nurses like us should make sure that our patients have clean water, clean air, and a comfortable place to recover. And it's like creating a healing space to help our patients get better faster. Yan po yung thinking ni Florence Nightingale, and that is called the environment theory. Okay? Pag-aralan naman natin ang idea ni Betty Newman sa kanyang concept of nursing. According to Betty Newman, a person is an open system that interacts with the environment, and nursing is aimed at reducing the stressors through primary, secondary, and tertiary prevention. So alam naman po natin that stress is one of the leading causes of diseases and health problems, okay? Now, Betty Newman's nursing theory is about keeping the patients stable by helping them manage their stress. And nurses like us should work with the patients to prevent problems and keeping them balanced. And it's like being a guide to help people stay well and cope with challenges. So, ibig sabihin nito, meron din itong yung kanyang idea of what nursing is, meron din siyang aspect of collaboration with our patients and letting the patient tell us what stresses them. Ano yung mga stressors nila, and we can work with our patients para po malimitahan yung mga stressors na yon so that our patients can remain healthy as much as possible. Like for example, if a patient just got pregnant, and then, yung patient na po ito she is telling you na meron akong bleeding. And then, when you ask your patient, gumawa ka ng assessment mo, okay, sa pregnant patient na to, you realize na yung bleeding niya is caused by a strenuous activity. Yung pasyente mo, kahit buntis pala siya, nagtatrabaho pa rin ng mabibigat. So, you have already identified the stressor that is causing the patient bleeding. So, anong gagawin mo? You have to tell the patient, ma'am, I think yung stressor or yung reason kung bakit ka nagbe-bleeding is because you're still doing heavy job even if you are pregnant. So, dapat we work together with our patients to remove the stressor para po hindi na magkaroon ng negative effect ito sa ating mga pasyente. That is the idea of Betty Newman of what nursing should be. Now, let's also have a look at the self-care deficit theory of Dorothea Orem. According to Dorothea Orem, the focus of nursing is on the individual. So, dapat daw po mag-focus tayo sa individual level or sa ating patient care. Now, clients are assessed in terms of their ability to complete self-care, and care given may be wholly compensatory, meaning the client has no role on it, or it can also be partly compensatory, or the client participates in the care, or supportive educational, or the client performs own care. Now, a good example of this is when a patient na teenager gets pregnant and then she becomes a mother. Okay? So, first-time mother lang po ng pasyente na to. Now, according to Dorothea Orem's self-care deficit theory, may mga instances daw na yung mga pasyente natin are not able to perform healthcare, okay, or self-care. Now, dito na po papasok yung nursing. For example, our patient who is a new mother does not know how to initiate breastfeeding. Hindi siya marunong magpasuso. Therefore, nasistress siya ngayon, bakit walang lumalabas na suso sa akin, nagatas sa akin, I should say. Walang lumalabas na gatas sa akin. Now, papasok po tayo as nurses to help the patient so that they can perform that self-care. Okay? So, anong gagawin natin? So, the first thing that we do is we assist our patients. Ang gagawin natin, ma'am, lagyan po natin siya ng warm compress para po mag-open yung mga blood vessels para po mag-produce ng gatas yung iyong suso. You also let the baby suck the breast para po lumabas yung gatas because of the release of the hormone oxytocin. Ma'am, yan po yung gagawin natin. So what happens? We are already helping the patient to perform the care that she needs. Okay? So, ibig sabihin yan, natutulungan po natin yung ating pasyente so that in the event po na mawala po tayo, okay, or yung pasyente po ay lumabas na sa hospital, the patient can still perform this skill or task on herself at she will be able to maintain her health. A good example again is yung mga sarili nyo. Pag kayo po ay nagkakasakit, what happens is that you do not have the energy to feed yourselves. You do not have the energy to go take a bath. Di ba po, yun yung nangyari. So, meron kayong self-care deficit because you are not able to care for yourself fully. So, dito na po papasok yung role natin as nurses. So, since meron pong self-care deficit, yung pasyente, hindi niya kayang alagaan yung sarili niya, anong gagawin natin? As nurses, we can give care that is wholly compensatory. Hindi kaya ng pasyente na kumain. Anong gagawin mo? Ikaw ang magpapakain during the times na sobra yung sakit ng pasyente. Now, as the patient goes to recovery, Nagre-recover na yung pasyente, nakakaya na niya na maghawak ng kutsara at tinidor na pakainin yung sarili niya. Okay, that's already partly compensatory until such time that the patient can already provide self-care kasi wala na pong self-deficit. So yun po yung idea ni Dorothea Orem of what nursing is. Dapat po ay tignan daw natin yung ating mga pasyente and we identify the self-care deficit na nandun sa ating mga pasyente, and dahil nga meron pong deficit doon or may kulang na naibibigay yung pasyente sa kanyang sarili, pupunan po natin mga nurses yung deficit na yon. So that's the idea of Dorothea Orem. Iba naman po yung understanding ni Ida Jean Orlando of what nursing is and what it should be. Now, according to Ida Jean Orlando, the focus of the nurse is interaction with the clients. And effectiveness of the care that the nurse provides depends on the client's behavior and the nurse's reaction to that behavior. Meaning, the client should define his or her own needs. Now, anong ibig sabihin nito? Ida Jean Orlando's nursing theory is about understanding the patient's needs through their actions and words. Kaya nga daw po kailangan po nating i-observe yung ating mga pasyente and we have to interact with them so that we can understand them fully. Now, ano bang gagawin natin sa observation natin sa kanilang actions and sa kanilang words? We will use this to help understand our patients better. We nurses should use this insight, yung mga nakuha natin na insight and understanding based on the patient's actions and words, gagamitin po natin yon to provide better care and relieve stress of the patient. It's like listening carefully to patients to give them the right help. So dapat daw ay maging sensitive tayo and we should also be keen and observant when it comes to interacting with our patients so that we will understand our patients better para po maibigay natin sa kanila yung tamang care na kailangan po ng ating mga pasyente. Pero perhaps sa mga nursing theories na nadidiscuss natin, dito po ako pinakamas nag-gravitate towards. Dito po yung aking understanding of what nursing is. Dito din po siya rooted kay Rosemary Rizopar. Okay? According to Rosemary Rizopar, nursing is a human science and health is a lived experience. And man living health as a single unit guides practice. Marahil ay nagtataka kayo kanina kung bakit ko nasabing pinaka nag-resonate sa akin yung nursing theory ni Rosemary Rizopar na health is a lived experience. Kasi naniniwala din po ako na gaya ni Rosemary Rizopar, I also understand that we experience things differently. Okay? So, ibig sabihin po nito, health is yung sinabi ni Rosemary Rizopar na health is a lived experience, ibig sabihin iba-iba po tayo ng karanasan or experience kahit pa pare-pareha po tayo ng kondisyon or situation. Sir, ang gulo po. Okay, I'll give you an example. Person A rode the roller coaster at Star City. So, nagsumakay siya sa roller coaster and then, ang nangyari, na-enjoy niya yung ride. So, sabi niya, I wanna do it again. I like it. Okay? So, that's his lived experience of riding a roller coaster. Pasok naman po si patient 2. Okay? Or rider B. Sumakay siya ng same roller coaster, pareho sa sinakyan nung nauna kanina. They rode the same roller coaster pero sabi ng isa, ayoko na ng experience na to. Nahihilo ako. Sumasakit yung ulo ko, naduduwal ako, gusto kong mag-vomit. I will not repeat that experience ever again. Now, that is a great example of the health as a lived experience. Kasi nga po, we experience things differently. Kahit papareho sila ng sinakyan na roller coaster, patient A and patient B experienced that ride differently. The same is true with our patients. Yung mga pasyente natin, maaaring sa kanila blessing ang pagbubuntis. I love getting pregnant because this is what I've prayed for. Maaaring yun ang experience ng ating pasyente, that pregnancy is pleasant. But there are other patients who will say, ayoko nang maging buntis. Kasi they might experience different health concerns pag sila ay pregnant. Hindi sila nakakalakad, nagiging sensitive sila sa kanilang pagbubuntis, or maaari ding yung mga ibang pasyente, they got pregnant because they were raped. Because their boyfriend did not really withdraw yung tamang timing. Okay? So maaaring for some, a condition, a health condition, may be pleasant, while to the other, it may be different. So anong ibig sabihin nito? Na as nurses, we should also try to consider how our patients are living their experiences. Okay? So dapat po ay alalahanin natin na yung mga pasyente natin are unique individuals and hindi dapat natin sinasabi, Mrs., yung mga ibang pasyente ko naman, hindi ganyan yung ugali, hindi ganyan. Mrs., makipag-cooperate ka. You should always remember po that our patients are experiencing life, their conditions, differently. They have unique lived experiences. So, to sum it up, according to Rosemary Rizupar, nursing is about seeing each person as unique. And nurses should work to understand the patient's experiences and help them find meaning in their health journey. Now, it's like focusing on individual and their stories to provide personalized care. Dapat po ay kausapin natin, we get to know our patients so that we will really understand how they are living their experiences para po makapagbigay tayo ng karampatang care and services to them. Tumungo naman po tayo sa understanding ni Hildegard Pepo of what nursing is. According to Pepo, the promotion of health is viewed as the forward movement of the personality, and this is accomplished through an interpersonal process that includes orientation, identification, exploration, and resolution. Now, according to Hildegard Pepo's nursing theory, it is about building relationships with our patients. Kaya nga po meron siyang orientation, identification, exploration, and resolution of the condition of our patients. And nurses need to communicate and understand to help the patients heal. It's like being a supportive friend while giving medical care. Yun po yung sabi ni Hildegard Pepo, kailangan po natin una ma-orient sa ating pasyente ang kanilang mga problema, and then we will help our patients identify their health concerns, and we will explore the many possibilities of us on how we can assist our patients. And lastly, we will now resolve the problem of our patients through nursing care. So yun po yung thinking ni Hildegard Pepo of what nursing is. Now let's also have a look at what Martha Roger has to say when it comes to her theory of nursing. According to Martha Roger, the purpose of nursing is to move the client towards optimal health. So tutulungan daw po natin yung ating pasyente to reach the optimal health, and that is our role as nurses. The nurse should view the client as a whole. Ito po yung lagi nyong tatandaan when it comes to Martha Roger's theory. The client is viewed as a whole and constantly changing, and we should help people to interact in the best way possible with the environment. So, ibig sabihin, sabi ni Martha Roger, yung isang tao daw ay isang unique individual that has many aspects. Nandyan yung physical, emotional, spiritual, mental, social, psychological. So the person is viewed as a holistic individual that is constantly changing. Nagbabago-bago po yung taong yon, and we should help that person interact with the environment in the best way possible so that we can help them achieve and maintain that level of health. Now, Martha Roger's nursing theory is about seeing the patient as a holistic being that is connected to the environment. And nurses like us should focus on promoting harmony between the patient and their surroundings for healing. So katulad din ito ni Florence Nightingale about the environment theory. Pero this time, we also consider how everything around the person impacts their well-being. Kasi nga po, holistic po yung thinking natin when it comes to our patients. Kay Florence Nightingale kasi, the environment is viewed as something that can help an individual recover. Dito naman po, hindi lang po yung external environment yung pinag-uusapan. Kay Martha Rogers, she also considered the internal environment of a person. Kunwari, yung isang pasyente po, kahit na nakatira siya sa magandang lugar na very healthy, if his internal environment is tumultuous, meron siyang mga maraming problema, maraming iniisip, maraming worries, that person, even if he is full or surrounded by healthy things, healthy food, hindi pa rin yan makakakain ng tama kasi nga po meron siyang problema in the internal environment. So according to Martha Rogers, we do not only care for our patients considering the external environment, meron din pong internal environment na kailangan nating ayusin as nurses, and that will also help the patient gain optimum level of health. So yun po yung thinking ni Martha Rogers of what nursing is. Last but not the least is the theory of Sister Calista Roy. The role of the nurse is to aid the clients to adapt to the change caused by the illness. That is according to Sister Calista Roy's adaptation theory. So, dapat daw ay tulungan natin yung ating mga pasyente to adapt to the changes in their condition that affects their health. Dun daw po pumapasok yung nursing. Levels of adaptation depend on the degree of the environmental change and states of coping ability of our patients. And full adaptation includes physiological interdependence. So, ano bang ibig sabihin ni Sister Calista Roy? Tutulungan daw dapat natin as nurses yung ating mga pasyente to adapt to the different changes that happen to themselves or to their environment that may cause illness. Okay? For example, yung pasyente po natin ay first time na maging pregnant. And dahil nga sa kanyang pagbubuntis, nasistress siya sa kanyang pagbubuntis because of the many hormonal changes, physical changes that happen to that person's body. Now, because of the change, yung tao po ay nakaka-experience siya ng mga sense of inconvenience or discomfort. So, ang role daw po natin as nurses is to help that patient to adapt to the changes that happen in their body. So, hindi lang yan pwedeng pregnancy, pwedeng sasakit din. Pag may sakit yung isang patient, nakakaramdam siya ng mga changes in their body. And our role is to help our patients adapt to that change. Now, according to Sister Calista Roy, her nursing theory is about helping the patients adapt to change. And nurses should support the patients to cope with the health challenges and help them find balance. Ang role natin is like guiding our patients through tough times to improve their well-being. So, tutulungan natin yung ating mga pasyente to adapt to whatever it is that they find problematic, okay? Para po hindi sila magkaroon ng health problems. And that concludes our discussion of the different theories that are connected to nursing. Marahil ang nasa isip nyo ngayon ay ang dami namang mga nursing theories, pare-pareho lang din naman yan. Actually, you have to remember that nursing is an art, na iba-iba po tayo ng interpretation of what an abstract artwork is. Same is true with nursing. Iba-iba din po tayo ng ating interpretations of our roles and goals as nurses. May mga iba sinasabi that the care that we should provide is respectful to our patients' wishes. Yung mga kagustuhan dapat ng ating mga pasyente ang nasusunod, and that is what nursing is. May mga ibang nagsasabi that our role is to help them find balance. May mga iba nagsasabi na Our role as nurses is to understand our patients, how they are living with their experiences para ma-achieve natin yung kanilang optimum level of health and well-being. Iba-iba po ang interpretation natin ng ating mga nursing service, our nursing skill, the care that we provide, iba-iba po ang interpretation natin kung ano yung mga roles natin as nurses. And that is beautiful. Why? Because even if we see things differently, we understand nursing differently, it ultimately tells us that no matter the nursing theory that we are using, no matter the nursing theories that we are replicating or we are following, iisa lang po ang ibig sabihin niyan. It is our goal as nurses to provide the best care possible to our patients. So kung kailangan i-respect natin yung culture ng ating mga pasyente, kung kailangan i-understand natin or mag-interact tayo sa ating mga pasyente and observe their actions and their words, we do it so that we can provide the highest level of care to all of our patients. Lagi niyong tatandaan na hindi po one size fits all ang nursing at marami po tayong mga nursing theories na na-discuss because we should be ready when we care for different patients from different walks of life. Okay? So sana po ay meron kayong natutunan sa ating lesson regarding the different nursing theories. At dahil dyan, mag-attendance check na po tayo. And this will be how I will be checking your attendance for today's discussion. Now, I want you to review the different nursing theories that I have discussed. And I also want you to create a simple explanation of what you think our role as nurses is in maternal and child health nursing. So, parang gagawa kayo ng mini nursing theory nyo that is revolved around taking care of maternal and child. So, yun po yung ating attendance check. So, saan po ito i-upload? I will be creating a discussion forum sa ating Google Classroom, and that is where you will place your mini nursing theory of what nursing should be in terms of maternal and child nursing. Alright? Let's continue our discussion. As future maternal and child health nurses, you should also know your roles and responsibilities. Dapat alam nyo yung mga kailangan nyong gawin at yung mga functions ninyo so that you can perform them the best way possible pag kayo ay nag-graduate na and you become licensed professional. Now, isa sa mga role ng mga maternal and child nurses is preconceptual care. Anong ibig sabihin nito? It is our responsibility as nurses to help people plan for a healthy pregnancy. So, yung mga gustong magkaroon ng anak, tulungan po natin by helping them plan a healthy pregnancy. We provide information about health, lifestyle, and contraception options. And we also assess the risks. We also offer advice to our patients and refer them to specialists if needed. So, isa yan sa mga roles natin as preconceptual healthcare nurses. Dapat po, we also need to offer support and guidance for a smooth start to starting a family or getting pregnant. So yan po yung gagawin po natin as as part of our services as maternal and child nurses, yung preconceptual healthcare. Aside from that, we also give care of women during the first 3 trimesters of pregnancy and puerperium. So dapat po may ibang care na ginagawa tayo on the 6th week after childbirth, postpartum, first 3 months, the next 3 months, the last 3 months, iba-iba po yung care na ginagawa natin. So that is also our role as nurses. Sir, iba-iba ba? Yes. On the first trimester, that is the stage of organogenesis. Tinutulungan natin yung ating pasyente to know the different things that should be prevented or should be avoided. For example, pag yung pasyente po ay
3 months pregnant, ibig sabihin, yung bata nabubuo pa lang yung kanyang mga organs, dapat ay hindi siya nagtitake ng kung ano-anong mga gamot, that she should have the best maternal nutrition possible para hindi magkaroon ng abnormalities yung anak. Things like that, okay? So we also give those kinds of care to our patient depending, of course, on the life stage of the fetus. We also give care of children during the perinatal period, or we care for children 6 weeks before conception to 6 weeks after birth. And we also provide care of children from birth through adolescence. So yan po ay responsibility din po natin as maternal and child nurses. And we also give care in settings as varied as the birthing home. Pwede din po tayong magtrabaho sa pediatric intensive care unit and even the home of our patients. Now, anong ibig sabihin nito? You have to remember that as nurses, our role is not limited only to the patients that are already there, na nakikita mo na physical patient na, hindi po. The care that we provide also extends to the embryo that is developing rapidly on the body of the woman. Okay? So, ibig sabihin nito, hindi lang po yung mga buntis na pasyente yung tinitignan natin, we are also looking into the health of the growing embryo. And what should we do? We should educate our patients. As maternal and child nurses, we should provide guidance on healthy habits, nutrition, and managing pregnancy symptoms. Aside from that, kailangan po nating magbigay ng symptoms guidance, okay? We offer advice on handling common symptoms of pregnancy, like for example, fatigue, nausea, mood changes. Yun din po yung isa sa mga services na pwede nating maibigay. We can also provide testing coordination, or we can arrange and explain essential laboratory tests, which may include blood test and ultrasound to our patient. Kasi nga po sila, nasa-stress sila. Kasi buntis yung ating mga pasyente. So they might not be familiar with these tests and they might think, oh, ano ba, mamamatay na ba ako kasi ang daming mga lab tests na pinapagawa sa akin. We should give them appropriate emotional support and education when we are doing tests to them. Okay? Aside from that, we can also help in health monitoring. We can do regular vital signs check to our patients and monitor their weight and help them track the pregnant woman's well-being. Aside from that, we can also provide emotional support. We listen to the concerns and provide emotional reassurance to our patients during this critical time. Marami po sa ating mga pasyenteng pregnant ang nagkakaroon ng mga emotional problems kasi nga po because of their hormonal imbalances. And because of that, we can also use this emotional support as part of our roles and responsibilities as nurses in maternal and child nursing. And we can also do referral. Okay? If complications arise in our patients, we ensure prompt referral to specialized care. Kunwari, meron kang kinakausap na pasyente na buntis. Tapos sinabi niya, Ma'am nurse, bigla akong nag-bleeding, marami po yung bleeding ko. So immediately, you refer your patient to specialized care. So yan po ang isa din sa ating mga roles. And lastly, communication. We nurses maintain communication not just with our patient, but other healthcare providers for coordinated care to our patients. So those are our roles and responsibilities as maternal and child nurses. Hindi lang po sa pagpapaanak, pagbibigay ng gamot, or pag-a-assist sa ating mga pasyente to deliver. Hindi lang po yun. We have so many roles as future maternal and child nurses. Apart from our roles and responsibilities to the mother, we also have roles and responsibilities as maternal and child nurses to our patients. Meron tayong tinatawag na roles and responsibilities natin to our newborn baby or to our pediatric patients on the first 1,000 days. So, sa unang 1,000 days ng bata, meron po tayong mga specific na functions na ginagawa as nurses. At ano po yun? Number 1 is breastfeeding support. We educate and assist the mothers in establishing successful breastfeeding kasi kailangan po ng bata ang optimum nutrition on the neonatal period up to infancy. dapat po nakakapagpa-breastfeed yung mother so that the child can get the nutrients that they need to survive. Aside from that, kailangan din po tayong magbigay ng nutritional guidance. We, nurses, provide guidance on introducing solid foods and ensuring a balanced diet to the pediatric client. Okay? So, ibig sabihin nito, tinuturuan din natin yung nanay kung ano yung mga kailangang ibigay niyang complementary and supplementary foods sa kanyang anak pag siya ay lampas 6 months na, because the child cannot rely on breast milk alone. Kailangan din niyang kumain ng mga solid foods, and that is where we come in. We can provide nutritional guidance to the mother so that they can introduce solid foods better and ensure a balanced diet. Aside from that, it is also our role and responsibility to monitor the growth of the child, or what we call growth monitoring. We nurses track the baby's growth and development and plotting it on the different charts and addressing any concerns that are reported by the mother. Aside from that, nagbibigay din tayo ng immunization. Okay? We are the ones responsible for immunization scheduling of the patient. We ensure that the baby receives vaccinations according to the recommended schedules. Okay? Kasi hindi po pwedeng binibigay yung mga immunizations kung gusto lang ng pasyente. Hindi po. Meron tayong sinusunod na tamang edad, tamang timing ng sa pasyente. Kaya kailangan po natin na i-perform din yung role natin when it comes to immunization scheduling. Aside from that, we also monitor the developmental milestones of our patients. Meaning, we nurses monitor and encourage the achievements of developmental milestones. Kunwari yung bata, 2 years old na pero hindi pa nakakapagsalita. Hindi pa niya nare-reach yung developmental milestone na yon. Or yung bata, 3 years old na, hindi pa din naglalakad. So, you can already say that merong developmental delay yung bata kung ganon. So, it is our job as nurses also to help these patients attain these developmental milestones. Kung hindi pa nila nare-reach yung milestone na yun, we can refer our patients to specialists. Okay? It is also our role to give parenting education. We offer guidance on safe sleep practices of our patients, baby care, and responding to feeding cues. So, nagbibigay din po tayo ng information dissemination and health education sa mga magulang na hindi pa alam kung paano maging parents. Okay? Hindi pa marunong mag-alaga ng bata. We can also give them education. So, isa din po yun sa ating mga roles and responsibilities. Aside from that, we also provide early intervention. We nurses can identify any developmental delays and facilitate early intervention services if needed. Gaya nga ng sinabi ko kanina, kapag nakakakita tayo ng delay or abnormality sa ating mga pasyente, we refer them to specialists. Ang tawag natin po doon sa process na yon ay early intervention. We also can provide emotional support to our patients by addressing postpartum concerns. Lagi niyong tatandaan po na kung yung babae katatapos lang manganak, she may also be prone to many psychological problems. Maaaring siya ay maging malungkot, maging depressed, maging anxious, and therefore, it is our role to provide emotional support to our patients, especially during postpartum or pag natapos na siyang manganak. We also give family engagement, or we also are responsible for family engagement. We involve the family in the baby's care. Okay? And we also foster a supportive environment. Kung sabi ng nanay, hindi ako marunong mag-alaga ng bata. Kung sabi naman ng mga ng mga ibang members of the family, ay ayokong alagaan kasi parang fragile yung bata. We give them the right skills, the right tools so that they can care for the child. Ang tawag po natin dyan ay family engagement. Isa din po yan sa mga roles natin as maternal and child nurses. And healthcare coordination by coordinating well baby check-ups and providing guidance on healthcare decisions. Ibig sabihin nito, pag yung nanay hindi masyadong nakaka-decide or yung nanay po ay hindi masyadong alam yung mga pinipiling healthcare decisions niya, we also assist them in arriving at the best decision for their patients. Kaya nga po, kailangan ang mga nurses sa maternal and child nursing, sa maternal and child health, kasi po madami tayong roles na ginagampanan, not just to our pregnant clients, but also to our unborn child and also to our growing patients na pediatric. Okay? Now, bukod sa maternal and child nursing, marami din pong advanced practice roles ang mga nurses. Okay? So, ibig sabihin, hindi lang po sa maternal and child nurses pwede tayong mag-thrive as individuals and as professionals. Marami pa rin po tayong mga pwedeng roles pa na pwedeng gampanan din. And number 1 po dyan yung clinical nurse specialist. These nurses are prepared at the master's or doctorate degree level who are capable of acting as consultants in their area of expertise. So, ito po yung mga expert nurses na sa kanilang fields or fields of specialization. They also serve as role models, researchers, and teachers of quality nursing. So, yung tinatawag po nating clinical nurse specialist or CNS are advanced nurses with deep expertise in a field like cardiology or mental health, ganon. They provide advanced care to complex cases. They also educate patients and fellow staff. They also conduct research and often take leadership roles. And they are also specialized experts that are dedicated to enhancing patient care and healthcare practices. Now, ano ba yung mga iba't ibang clinical nurse specialists na tinatawag natin? Meron tayong tinatawag na pediatric CNS, may mga psychiatric CNS or mga oncology or cancer CNS, geriatric CNS, cardiology, diabetes, neurology, all fields of nursing, meron po tayong tinatawag na clinical nurse specialists dyan. Now, ano naman po yung mga neonatal nurse specialists? These are nurses who manage the care of infants at birth and in intensive care settings. So, ito po yung mga nurses who have dedicated themselves to taking care of children under 28 days, okay, or younger than 28 days old. Ito po yung mga nurses na nag-aalaga dito sa mga pasyenteng to. They provide home follow-up care to ensure that the newborn remains well. So, lagi nyo pong tatandaan, na yung mga neonatal nurse specialist, inaalagaan nila children below 28 days old. Now, neonatal nurse specialists are highly trained, registered nurses who are specialized in providing advanced care to newborn infants, particularly those who are born prematurely and have medical complications. So, yung mga bata pong pinapanganak na preterm or may mga medical complications and emergencies, or those that require specialized medical attention, yung mga neonatal nurse specialist po ang nag-aalaga sa kanila. They play a crucial role in neonatal intensive care unit. So, nakikita po natin sila sa NICU and other settings where newborns with complex medical needs are treated. So, okay? So, sila po ang nag-aalaga sa mga critical na mga neonatal patients. So, saan po natin nakikita ang NNS? Nakikita po natin sila sa critical care for neonatal patients, sa NICU, sa pedia ward, or even in surgery. Kasi po, tumutulong din sila na nag-aalaga sa mga pasyente, neonatal patients who are undergoing surgery. Meron din po tayong tinatawag na childbirth educator. Isa din po yan sa mga pwede nyong maging career as nurses in the future. Ano bang ginagawa ng childbirth educator? They teach families about normal birth and how to prepare for labor and delivery. Ang ibig sabihin niyan, childbirth educators are trained professionals who provide information, guidance, and support to expectant parents before, during, and after childbirth. So, tumutulong po tayo sa mga pasyenteng gustong magkaroon ng anak. Okay? Our primary goal as childbirth educator is to educate and prepare the parents for the birthing process and helping them make informed decisions as about labor, delivery, and early parenthood. It is the role of the childbirth educator then to provide education on pregnancy, what to expect during childbirth, ano yung mga pwedeng mangyari kapag manganganak na sila, postpartum, and the risks involved in pregnancy. Ibig sabihin, the main role of the childbirth educator is to help patient make informed decisions before, during, and after delivery. Another career that maybe you can consider when you become professional nurses is becoming a lactation consultant. Ang role nito is that they educate women about breastfeeding and support them while they learn how to do breastfeeding. So, ang ibig sabihin niyan, lactation consultants are specialized professionals who provide expert guidance and support to new mothers and families with breastfeeding infants. Okay? So, ibig sabihin nito, the primary focus of the lactation consultant is on helping the mothers establish successful breastfeeding relationships by addressing challenges, offering solutions, and promoting positive breastfeeding experience. So magfo-focus kayo po sa breastfeeding at tignan nyo kung ano yung mga nagiging problema ng mother na yon, and you offer solutions to these problems. Now, the lactation consultant should be expert when it comes to breastfeeding, and they should also be able to provide postpartum support to women, especially on nutrition and pediatric care. Okay, meron din tayong tinatawag na genetic nurse counselor. Maybe you can also consider this when you become licensed nurses. The role of the genetic nurse counselor is to consult with families about patterns of inheritance and offer support to families with a child who has inherited a genetic disorder. So, ang ibig sabihin nito, the genetic nurse counselor is a specialized healthcare professional who provides support, information, and guidance to individuals and families who are dealing with genetic conditions or any concerns that are related to genes, okay? So they play a critical role in helping people understand the implications of genetic information, make informed decision, and help these patients in the managing the complexities of genetic testing and healthcare. Marami pong mga abnormalities, yung mga tinatawag natin na Down syndrome, mga yon, mga Klinefelter's disease. Marami pong mga pasyenteng may mga genetic na inherited disorders. And the role of the genetic nurse counselor is also inform these families na may ganitong klaseng mga members of their family on how to properly take care of them. So when you want to become genetic nurse counselors, you should have an expertise and in-depth knowledge about genetic disorders, about inheritance patterns, and about medical and psychological aspects of genetic conditioning. So dapat po expert kayo sa ganung field. And also, isa din sa mga ginagawa ng genetic nurse counselor is to do counseling sessions where they assess family histories, mga genetic risks nila, and individual concerns. They help individuals understand the likelihood of passing one genetic condition to the next generation and provide guidance on family planning and reproductive options. Gaya dito, meron kaming kapitbahay dito na lahat ng mga lalaking anak nila ay may mga genetic malformations and hindi sila nabubuhay beyond 15 years old. Yung mga lalaki, sila yung mga nagkakasakit ng ganun, it's in the tip of my tongue kung ano yung genetic condition na yun, but lahat sila pag lalaki, namamatay early, meron silang mga kakaibang itsura, pero when it comes to women naman, sa mga anak nilang babae, normal naman sila. Okay? So, the genetic nurse counselor can step in and intervene to that family para alam nila how to properly care for these patients and also to how to properly avoid these kinds of families in the future para alam nila yung mga pipiliin nilang maging partners para hindi na maipasa yung problem na to or genetic disorder na to. So, that is also the role of your genetic nurse counselor. We also consider case managers. Baka gusto nyo ding maging role yan when you become professional nurses. As case managers, you have to be a graduate level nurse who supervise a group of patients from time they enter a healthcare setting until they are discharged from the setting, or in seamless care system into their homes as well, monitoring the effectiveness, cost, and satisfaction of their care. Ang ibig sabihin ng case managers po, ang case managers are healthcare professionals who coordinate and manage the care and services provided to individuals who require ongoing medical treatment, support, or assistance. Ang ginagawa po ng mga case manager ay parang sila yung nag-specialized in taking care of this specific case. For example, case manager ng mga HIV clients, mga ganun po. Case manager ng mga patients with cancer. Sila po yung nagbibigay ng medical treatment, support, and even coordination to the care to be received by these patients. Now, yung mga case managers po, they play a pivotal role in ensuring that patients receive the appropriate and necessary care, resources, and services to achieve optimum health outcomes. Meron din po tayong tinatawag na nurse practitioners. Ano nga po yung mga nurse practitioners natin? Nurse practitioners, or what we call NPs, are advanced practice registered nurses that are masters and doctorally prepared, and they possess advanced education and training that allows them to provide a wider range of healthcare services to individuals across lifespan. Now, yung mga nurse practitioners natin, they have the authority to diagnose and treat medical conditions. They can also prescribe medications, and they also play a vital role in promoting health, preventing illness, and managing chronic diseases. Now, yung mga nurse practitioners, they can provide holistic approach to patients, and they also possess knowledge in primary and specialty care skills. Primary care clinics, nagtatrabaho din sila sa hospitals, and specialty clinics, and urgent care centers, and more. So, ibig sabihin nito, they provide both general healthcare services and specialized care in areas like pediatrics, family medicine, geriatrics, ganun po. In some states in America, yung mga nurse practitioners nila or advanced practical registered nurses, they are able to diagnose and prescribe medications to clients if the condition of the patient is on their expertise. So parang nagiging mini doctors po sila na meron silang mga added na mga certifications, and because of that, pwede na silang gumawa ng mga or mag-order ng mga ginagawa ng doktor. Like for example, diagnosis and prescription, pwede na nila yung gawin on their level. But you have to be certified in that state of America if you want to become a nurse practitioner and if you want to do those kinds of things. Okay? So, meron din po tayong tinatawag na Women's Health Nurse Practitioner. A Women's Health Nurse Practitioner is an advanced practice registered nurse, or parang parte rin po siya ng nurse practitioner, or what we call the Advanced Practice Registered Nurse. Offshoot po siya ng APRN or ng NPs na ito. Okay? They specialize in providing comprehensive healthcare services that are specially tailored to the unique needs of women across their lifespan. So, ang ibig sabihin nito, yung mga women's health nurse practitioner po, they have advanced education and training that enables them to address various women's health concerns that are ranging from reproduction to gynecological issues to general awareness and preventive care. So, ibig sabihin nito when it comes to the health of the woman's reproductive system, pregnancy, mga ganito po, sa mga women's health nurse practitioner po tayo pupunta. Okay? Now, like I said, the women's health nurse practitioner, they specialize in women's health, and they have a strong emphasis on reproductive health, gynecology, and wellness throughout the different life stages of every woman. Okay? They provide reproductive and gynecological care and services to patients, including giving family plannings, contraception, prenatal care, tumutulong din sila sa childbirth, postpartum care, performing routine examinations like for example pap smear, nagagawa po ng mga women's health nurse practitioners. They are also able to care for women with menstrual irregularities or mga problema when it comes to pelvic pain, mga reproductive system infections. Ito po yung mga focus of care ng mga women's health practitioner. Meron din po tayong tinatawag na pediatric nurse practitioner. Maybe you can also consider this when you become licensed professional already. Now, ang pediatric nurse practitioner po is an advanced practice registered nurse who is already specialized in providing comprehensive healthcare services to infants, children, and even adolescents. So ito po, yung expertise niya ay below 18 years old na mga pasyente. These pediatric nurse practitioners have advanced education and training that enable them to deliver specialized care for pediatric clients, from well child visits to even diagnosing and managing complex medical conditions of sick clients. So, ibig sabihin nito, hindi lang po sila nag-aalaga sa mga well babies. Nag-aalaga din po sila sa mga babies or mga pediatric clients with complex medical conditions. Now, bakit nga po special yung mga pediatric nurse practitioners? They are special because they focus on the unique healthcare needs of infants, children, and adolescents, and they also take into account or they also consider the physical, emotional, and developmental stages of these pediatric patients. Lagi niyong tatandaan that for you to become a pediatric nurse practitioner, you have to be specialized in pediatric health. Dapat po magaling kayo sa growth and development, common childhood illnesses. You have to be knowledgeable in medical conditions to specific children for you to become pediatric nurse practitioners. Now, PNPs or pediatric nurse practitioners can provide routine check-up. So, pwede na po silang magbigay ng check-up. They can already give vaccinations and do growth assessments and developmental screening to ensure children are growing and developing properly. So, yun po yung mga roles na pwedeng gawin ng pediatric nurse practitioner. Meron din po tayong tinatawag na neonatal nurse practitioner. A neonatal nurse practitioner is an advanced practice registered nurse who specializes in providing specialized healthcare to newborns and infants, particularly those who are born prematurely. So ito po yung mga experts when it comes to taking care of premature babies or babies who have medical complications or those who require intensive medical care. Now, yung mga neonatal nurse practitioners naman po natin, they have advanced education and training that enable them to deliver comprehensive care to neonates in various healthcare settings, especially sa neonatal intensive care units. Doon po natin nakikita yung ating mga neonatal nurse practitioners. Lagi niyong tatandaan na yung mga neonatal nurse practitioners natin, they are specialized or experts in the care of newborn infants with a focus on premature babies and those with medical complexities. And nakikita natin sila sa NICU or nakikita natin sila sa na nagbibigay ng advanced medical care to newborns who require specialized attention due to their medical conditions. Lagi nyo din pong tatandaan na yung mga neonatal nurse practitioners, they are very good at managing yung mga mechanical ventilators natin or yung mga kinakabit natin para makahinga yung mga patients natin na neonates na 50-50. Magaling din sila when it comes to managing incubators and other medical equipments that are used to support the respiratory needs of premature or critically ill infants. So ito po yung expertise ng ating mga neonatal nurse practitioners. Meron din po tayong tinatawag na family nurse practitioners. And these family nurse practitioners are advanced practice registered nurses din that are specialized in providing comprehensive healthcare services to individuals of all ages, from infancy to adulthood. So parang generalists po ang ating mga family nurse practitioners. They are trained to deliver wide range of medical care and emphasizing on health promotion, disease prevention, and managing common acute and chronic conditions. So kung may mga specialized na doctors po tayo at merong tinatawag na family doctors or mga generalist, meron din po tayong ganong version. Ang tawag po natin doon ay family nurse practitioners. Okay? So lastly, meron din po tayong tinatawag na certified nurse midwives. Ang certified nurse midwife po or what we call CNM is an advanced practice registered nurse din which with specialized training in providing comprehensive healthcare to women during pregnancy, childbirth, and postpartum period. So yung mga CNMs po natin, they offer gynecological care to women throughout their lifespan and emphasizing on holistic and patient-centered approach. So ano ba yung ginagawa nila? Yung mga CNMs po, they are experts in women's health with a focus on pregnancy, childbirth, and reproductive health. And they can provide comprehensive prenatal care that includes health assessment, screening, and education to support a healthy pregnancy. So yung mga CNMs po natin, they also give care to patients during labor, during childbirth. So habang nanganganak yung pasyente, present din yung certified nurse midwife. They also provide emotional support, monitoring, and progress of labor. And sila din yung nag-a-assist with pain management techniques. Okay? And aside from that, they can also provide postpartum care sa mga pasyenteng natapos ng mga anak. Okay? They can also address recovery or breastfeeding support and even give newborn care. Now, ang knowledge po dapat ng ating mga CNMs, it should be focused on gynecological services. Dapat magaling sila when it comes to women examination and assessment. Dapat po magaling sila on family planning, on contraception counseling, and even screening for sexually transmitted infections. Okay? So, depending on the training of the certified nurse midwife, many may already perform procedures like pap smear or pwede din silang magbigay ng intrauterine devices and even do suturing of perineal lacerations. So yan po yung mga unique na pwedeng gawin ng certified nurse midwives. Now, sa dami ng mga pwedeng gawin ninyo or na mga roles ninyo when you become nurses, registered nurses, you have to remember your core. Lahat po ng mga fields of expertise na ito, they are centered on giving the highest quality of care possible to all our patients. So, ang ibig ko lang sabihin, no matter po kung ano yung field of specialization na magiging profession nyo someday as healthcare practitioners, dapat po yung goal ninyo is not to become elevated when it comes to your status na pwede mong maipagmayabang, ay, family nurse practitioner ako, ay, certified nurse midwife ako. Dapat hindi po yun yung focus natin why we will level up ourselves. But of course, ang focus po dapat natin is why we need to elevate ourselves to give the best care to all of our patients. And that concludes part 2 of our pre-recorded video lecture for the subject NCM 107, Concepts in Pediatrics. Sana po ay naintindihan nyo ang mga nursing theories, yung mga roles natin as maternal and child health nurses, and yung mga specialized fields na pwede nating i-pursue when you become professional nurses already. Again, maraming salamat po for listening. Have a great day everyone and enjoy the rest of the day.